From the beautiful Finger Lakes region of upstate New York, this is the Dental Lighthouse Podcast. We take questions from anyone in the dental profession and discuss what it takes to win not only in dentistry, but in life. Business, leadership, relationships, parenting, health and wellness, money management, nothing is off limits on the Dental Lighthouse Podcast. I'm Jason Tenori, your host, and have over 20 years of experience to pull from. Learn from my mistakes and let me help you collapse time so you can become the best version of yourself. Yo, Dr. Jason here, Dental Lighthouse Podcast, and it's been a minute since I've done a rambling, musing, and for good reason, right? So I was lucky enough to have some really good guests on the show. Dr. Addison Killeen and his book, The Shift. Had fourth-year dental student JD on for a two-parter. If you haven't listened to that, no matter how old you are, I would encourage you to go back and listen to it. Super bright kid. And, we talked about principles that are independent of age. So really good interview from my perspective. Obviously, I'm a little biased. And I've been traveling a little bit, right? So I did some lecturing for the Dental Nachos group in Philly and parlayed that into a family vacation, like a 4 or 5 day family vacation. So life's been good. Life's been busy. Life's been good. Baseball's over, which is bittersweet. I really love coaching my son and his 14-year-old team. But it's a lot. June and July are just nonstop. We play like 35 games in 60 days. So it's a lot of baseball. But that's over. And here we are. I wanted to talk today a little bit about a one-on-one that I had with one of my associates at our flagship office. Our flagship office, it's a pretty big office. It has 4 to 5 doctors, 8 to 10 hygienists on any given day. And this doctor has been with me for about 2 years, right out of residency in New York State. You have to do a residency to get your license. I don't agree with that as a capitalist, but I do agree with that as a business owner because it's just a lot easier to onboard someone that has an extra year of residency versus right out of dental school. But that's not the point of this recording. Anyways, as you guys know, I'm a strong believer in one-on-ones, and I do all of the one-on-ones with the doctors in my organization. So it was that time to have a one-on-one with this amazing doctor. And she routinely does about $125,000 a month in adjusted production, working 4 days a week. Bread and butter dentistry, starting to do a little bit of surgery, stuff like that. She's just growing. She's a great, great associate. Very self-conscious of her clinical dentistry and just wants to get better. She's taken some clinical mastery courses. Anyways, we were unpacking some things, and I could tell there was a little bit of, I don't know if the word is disappointment or I can't even really describe the word. So long story short, we kind of got into it, and she had shared with me that her August schedule was not nearly as busy as she has been, and she's not treatment planned to do the same amount of dentistry that she typically does. Like I said, $125,000 in dentistry. And she was frustrated by that. And she originally thought, well, maybe it's because the doctors are not breaking up the exams evenly. And maybe it's because less patients are saying yes. So I've done a fairly good job at training my doctors to look at data. So she did go back and look at the data, and she went back and she saw the amount of exams that she's done. And it was certainly at the minimum or more than she's done in the past. And she then looked at her case acceptance, and her case acceptance year to date, don't quote me on this, is about 35%. We thrive to be in that 30 to 40% range, depending on the type of dentistry that our docs are offering. So in her mind, she checked all the boxes. So she had just thought that something else was going on. She was getting frustrated. And it led to a great conversation about, okay, what can we control and what can we not control? And or another way, from the associate's perspective, what is the associate's responsibility? What is me as the owner's responsibility? And then, what is in neither of our control? So We first started to unpack what is in neither of our control? We're like, well, we can do everything possible to set the patient up to say yes. We can educate them. We can use photos. We can use X-rays. We can use AI, like Overjet. We've been using Overjet from a patient education perspective. We can tee up treatment. We can have the assistant say something along the lines of, I'm not sure what Doc's going to say here, but this is a little suspicious. This is a little funny. In other situations like this, Doc would recommend a crown, typical tee up stuff that we've talked about. So those are the things that we can control, right? We cannot control if the patient ultimately says yes. So my initial thought was, well, it's August. I know a ton of families that are taking vacation, and the dentistry, as much as we try to value it, maybe it's just not important to them right now. So if that's the case, then that's out of our control. But we started to peel back the onion a little bit, and this doctor is absolutely right. One of the first things I look at is case acceptance percentage. So when she looked at it, it was the same. It was the same over the last 4 or 5 weeks as it's been over the whole year. So then the next thing that I look at that she didn't look at was, well, how much dentistry did you actually present in July? Because simple math says that if your case acceptance is roughly a third, and again, hers is 35%, let's say it's a third just to keep the math easy, then you need to present 3 times the amount of dentistry that you plan to do. So if she's routinely doing $125,000 a month, you don't need to be Albert Einstein to know that on average, you need to be presenting $375,000 in dentistry. So I went back and I looked at every month for her for 2025, and wouldn't you know, she was right around $350,000 to $400,000 per month in treatment plan dentistry. And the result of that, with a 35% case acceptance, is doing about $125,000 a month. So we went back and looked at July, and it wasn't close to that. I believe the number was maybe $200,000. So when you normally present $375,000 to $400,000 in dentistry, and for whatever reason, and we'll unpack what the reason is, you have a particular month where you treatment plan 200,000, then don't be alarmed that your following month is not going to be nearly as busy as you want it to be. And we ultimately identified that that was the case. And there was a little bit of relief there, knowing, so at least now we know. But then again, let's peel back the onion a little bit more. And I talk about this little side note. I talk about this all the time with coaching clients when they're looking at scorecards, right? As you guys know, I'm a huge proponent of scorecards. And the reason I'm a huge proponent of scorecards is because on a weekly basis, you're looking at data. Hopefully it's relevant data, not data that's just busy work, but you're looking at data, and almost like a laboratory technician, almost like a scientist, you're looking at the number. And if it's not at goal, you should be saying to yourself, what's going on here? And you just start to ask questions. You start to peel back the onion a little bit more and a little bit more. So we saw the data. The data said that she had presented $200,000 of dentistry in July, not 400. Why is that? Well, the first reason is, well, maybe she didn't do enough exams. Well, we went to look at the amount of exams that she did, and it was actually higher than normal. What's going on here? So you just start asking questions. You just start peeling back the onion. So long story short, July is a nice month in upstate New York, and many of my doctors take time off, a week at a time, 2 weeks at a time. And not to go on a little tangent here, but we truly believe that the ideal hygiene to doctor ratio is 2-to-1, meaning each one of my doctors are ultimately responsible for their own 2 columns of dentistry, restorative, surgical, endo, and then 2 columns of hygiene. And as long as you have 2 competent assistants, you have an overflow room, and you're scheduling appropriately, you should be able to manage that. And you should be able to develop relationships in hygiene and treatment plan and what have you. Well, because we had doctors taking vacation, there were a number of days, probably half of the days in July, where this particular doctor was no longer responsible for 2 hygienists, but in some situations, 3 hygienists. And I would guess, and I didn't look to verify this, but I would guess there was probably a couple of days where she was responsible for four hygienists. So what happens when the ratios get off? Well, you're humming along in your own two columns, probably running a little bit behind or maybe a little bit ahead. And dentistry is not as predictable as we would like it to be. Someone can't get numb, or you can't find MB2, or you got to retake a scan, whatever it is. So then that gets compounded when you're now responsible for three, maybe four hygienists. So your hygiene exams are not nearly as comprehensive, as relational as you want them to be. Why is that? Because your only focus is to get back to your restorative chair and take that additional scan, or continue looking for MB2, or continue to, give the patient another block because they didn't get numb the first time. And that's exactly what was happening here. So because she felt so rushed, having to follow three, sometimes four hygienists, there was patients with tons of treatment needs, but she didn't have the time to take a deep breath, pause, and answer questions for the patient, develop a relationship with the patient, educate the patient. And she was in and out of the hygiene room in a couple minutes, right? So yes, was she able to stay on time? 100%. But the reason she was able to stay on time is because she didn't pour into the relationship and hygiene. So what I told her, and what I've told some of my other docs that have run into this issue from a coaching, when I have one-on-one coaching relationships, or even in our group coaching call, we talked about this a little bit last week. You're going to experience pain, and you have to ask yourself, do you want to experience the pain now, or do you want to experience the pain in a month? So what she did is she chose to experience the pain a month later. So what do I mean by that? She quickly went into hygiene. She, boom, 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 2-3 minutes a piece. And again, she's an amazing person. I'm not throwing her under the bus, but it is what it is. So, didn't really develop the relationship, didn't really treatment plan the dentistry that needed to be treatment planned. She probably thought in the back of her mind, I need to get back to my restorative chair. I can talk about this with Mrs. Jones in 6 months. And she gets back to her restorative chair and she finishes her procedure. So there was no pain that was exhibited now, right? So when is she experiencing the pain? She's going to experience, and is currently experiencing, the pain 4 weeks later, because she only presented $200,000 in dentistry in July. And now the pain is being experienced by an open schedule. So compare that to the pain of being in it right now, when you have to do 3 hygiene exams per hour. I'm going to run behind in my restorative columns. That's painful. I have to have some uncomfortable conversations with my patients, right? But because I'm going to do that, I'm going to have a little bit more time in hygiene to develop the relationship, to answer patient questions, to show the patient this cracked MOD on the TV screen in front of them. So I'm choosing to experience the pain now in the moment by running behind, because I'm taking a deep breath, I'm taking a step back, and I'm spending the time I need in hygiene. And by choosing to have the pain now, I will not have to have the pain of an open schedule in 4 weeks, because I'm not treatment planning $200,000 in dentistry for July. I'm treatment planning 375 or 4 or 425. So I will have a full schedule in August. So it just comes down to a simple question: when do you want to experience pain? And when it comes down to knowing the data, if you're not someone that believes in scorecards to share with your team, no judgment. I don't agree with you, but there's no judgment there. I do feel that even a scorecard that only you're responsible for, that only is going to keep you accountable as a dentist, as an owner, as an associate, track how much dentistry you're presenting on a weekly basis, and track what your case acceptance is. And if you want to produce more dentistry, you have to pull one of those levers. You either have to present more or get more patients to say yes. And if you're going to play the victim and say, I don't have enough opportunities to present more, That's a conversation that you either need to have with yourself if you're an owner from a marketing perspective, or you need to have with the owner if you're an associate. But again, going back to control what you can control, if there's not an easy solution to give you more at-bats, to give you more patients to treatment plan dentistry on, then you either need to get more patients to say yes, and that comes with empathetically listening. It comes with making sure that the case presentation system and flow is flawless. It comes down to making sure you have clarity on the financial arrangements that you're giving to the patient. The other option is to present more dentistry on the same number of patients. So how do you do that? You expand your skill set. You don't limit yourself to restorative dentistry. You do some endo. You do some surgery. You place some implants. You do some ortho. You go out and get more treatment planning CE. So you start to look at the same mouth differently because you didn't realize you didn't know what you didn't know. So I just want to kind of, in summary, ask yourself when you want to experience pain, either now or later. Keep yourself accountable with a scorecard, either a team scorecard. But if you guys don't believe in that, or if you're not to that point yet, then a private scorecard just kept on your own computer, on your own phone, that tracks dentistry presented, case acceptance. And if you need to pull some of those levers, ask yourself, how can I get more people to say yes? Or how can I get more at-bats? Or how can I present more treatment to the same number of people? When you do that, you'll ultimately see your adjusted production continue to go up month after month, and at the very least, not go down. So hopefully this gave you some perspective on some real world stuff that's going on in my own life and a lot of my coaching clients. If you have any questions, if you want to have a conversation about this a little bit more in depth, my contact information is on the website, thedentallighthouse.com. I look forward to speaking with you and talk to you on the next episode.
Thank you. That wraps up another episode of the Dental Lighthouse podcast. You have a choice today. Choose to be a lighthouse. Lighthouses are powerful and steadfast. They are beacons of light for others to reference when life gets turbulent. Go out into the world today and become a lighthouse for someone. Give more than you get. True joy comes from serving others. Start today. I'm Jason Tenori, your host. Thank you for listening to the Dental Lighthouse podcast. For more information, podcast show notes, or links to anything that we have discussed today, please check out our website, thedentallighthouse.com. We would love to hear from you. If you would like to get on the show, please email us at podcast@thedentallighthouse.com.